caloric restriction turns out to work really, really well to lose weight all the time, and it's never failed. The problem is some people go back to normal levels of calorie and they regain. The goal of a diet is typically to lose 5 to 15% of your body weight. Most health benefits occur at the 10% point. Generally, you have to eat less than you need on a daily basis between your basal metabolic rate and your activity. So you have to eat 15 to 60% less energy than you normally do to support your current weight. You will eventually burn fat, as we discussed before. Your body's preferential fuel source is always going to be fat. It's going to save the glucose and the glycogen for when it really needs it. If you lose this 10 to 15% of body weight, you will vastly lower your risk for things like dementia, cancer, diabetes, autoimmune disorders, et cetera, et cetera. This study, named the Caloric study, I've noticed that there seems to be a competition on naming studies. They all have to be an acronym that ends up being a word. This study was a caloric restriction over long-term study. They looked at 218 people. They were normal or moderately overweight. They restricted their diet for one group for 2 years, and the other group was allowed to eat their normal diet. The caloric restriction ended up eating 12% less daily than they normally did, and they lost 10% of their body mass, and they got really, really healthy. The control group lost no weight, did not get healthy, in fact got unhealthy, and they had far more inflammation when they looked at biomarkers. The groups that exercise, or the people that exercise, ended up preserving more bone and muscle. That is why exercise is important when you're on a diet plan. You want to keep your muscle and only lose fat. You don't want to lose protein.